The uncovered mentions, so like that. Walk around. recording, so I'm going to try to get close to the microphone. Normally, in work, we can see each other in a typical board meeting, so it's nice to have people participating in the public process. My name is Tim Roderick, and I'm the superintendent here at Prospect Mountain. We have been for the last 2 years, going to the third. I also, some of you may know, was served as the superintendent in Barnstead this past year, and as of a few weeks ago, in July, began serving also as the superintendent for all. So if that's confusing, here's what it means. You have essentially, Eunice will correct me because this actually technically isn't a district, but the easiest way to understand is you have 3 districts in these 2 towns. You run your 3 schools separately. This is the joint school board. It's comprised of 5 members from Alton, 5 members from Barnstead. Together, they govern this high school, SAU 301. Half of them, the ones from Barnstead, are also the Barnstead School Board. They have a meeting next Tuesday evening, I think that's the 24th, to talk about some similar topics that we'll hear here tonight, but regarding Barnstead Elementary School. Likewise, the other half of people up here are the Alton School Board. They have a meeting August 31st, 1 week before the first day of school. Again, to talk about some of these same things with regards to Alton Central School. I hope that helps anybody who wasn't crystal clear. I grew up in northern New Hampshire. We had 7 towns in the Kearsarge district, but it wasn't quite like this. We're a little unique here in all that Barnstead and in Prospect Mountain. So tonight we're talking about the high school, and look, it works. The last meeting of this joint board was on June 29th. And that night, the joint board approved these goals for reopening schools. Goal number 1 is to try to keep face coverings off. Goal number 2 is to bring everybody back. Now, the board adopted a schedule. Those of you who have high schoolers know the schedule of the school was different last year. It wasn't a 7-period day, it was a 4-period day, it was a shorter day. The board adopted a schedule for this coming year that's still a 4-period day, but we're getting some more structure during time. We brought in, all schools brought in a lot of new anti-static fogging and disinfecting and the new cleaning protocols last year. We continue all that. Their 4th goal was to be here 5 days a week. Yeah, those children in the high school know that that wasn't the case all of last year, and we want that to be the case this year. And then the 5th thing, and on June 29th, this was just kind of an idea floating out there in the future, is that some people were talking about this thing called variant, and you're going to have to pay attention to that. So here is what's changed since June 29th. And I think the best way to describe the size of change is right across the top. The thing at the bottom, if you talk about the new services, you see this picture. It includes all sorts of data. I pulled this today. That's today's. But I'm not going to read that. What I did is I pulled out at the bottom. A year ago today, we weren't here meeting, but New Hampshire had experienced statewide an average of 23 new infections a day for the previous 7 days. 1 year ago today. On June 29th, except for those 5 goals that I just talked about, New Hampshire had experienced 21 new cases a day previous 7 days. Here we are, 6 weeks later, and in the previous 7 days to today, New Hampshire has averaged 201 new infections per day. So the simple statement on this slide is that the situation has changed. That's fact. The one thing that's not likely to change is we're not done. And we may not be done. Not just now, not just this fall, not just this year. We may not be done. We may be, in our schools, accommodating new ways of doing business for I don't know how long to come, maybe years, maybe months. And if I say years and it ends up being months, you can make fun of me, that's okay. Part of the job is to guess and try to do the best we can. great. Figure things out, but this isn't going well. So we're not here tonight for the joint board to make a decision that's the decision that'll never change. That is not the world we live in. They'll make the best decisions they can tonight, and they'll get together again, make the best decisions that they can and that they need to adapt. The governor, a few days ago, made this statement in a news conference. He was talking about vaccination. And the governor's opinion, getting vaccinated is the best way to make sure that New Hampshire does not experience the kinds of high hospitalization rates in some states and some states. The governor's been consistent with this. I'll give the governor credit for this. I haven't been hesitant to criticize the governor. I thought he's got wrong over the last year, so I'll give him credit for this. He's been consistent. That his goal, our state government's goal, has not been to make sure nobody contracts coronavirus. He hasn't said that. What he said very consistently is keeping people out of the hospital and keeping people from dying. Those. So the way he's been talking to us about this, and I'm just going to move to the next slide, it's consistent. This message is that people are going to get sick. In fact, these are quotes from the governor's statements just 4 days ago. The fall surge, maybe this November, maybe this December, could be as bad as we've seen. And our job is to prepare for the worst while we hope for the best. And again, and I want to quote the governor on this, because I'm not here to start a controversy or participate. I'm here to do the best I can for this board and these communities. According to the governor, the best way for us to prepare is through the vaccine. The vast majority of those hospitalized are unvaccinated. I personally have been working with folks at one of our chains of hospitals in the region. And according to their internal data, more than 96% of the people they have in their chain of hospitals around New England with the coronavirus unvaccinated. This is from the PMHS School and Child Care Toolkit. There were 40 copies on the back table. So I don't know if they might all be them. But there could be a few back there still. Board members, you all have I've placed one in each of your seats. This document came out August 11th, last week. It's the first guidance specific to schools that we've received since about last May. It's lengthy. And again, it stresses promoting vaccination. Doesn't say anything about requiring vaccination. Says that we should promote vaccination as the #1 strategy for preventing spread, limiting the seriousness of infection, and limiting the duration of illnesses. So the message that I am hearing from our state is that vaccination works, and it's our #1 strategy to mitigate against coronavirus. So I wrote this as a decision because the school board is in charge around here, but until they tell us not to, the principal and I are going to continue to repeat these messages from the Department of Health and Human Services, that the #1 thing people can do to prevent outbreaks, or in the case of outbreaks, to minimize the seriousness, to reduce hospitalization, and to hasten the recovery process, is for as many people as possible to get vaccinated. Notice I didn't just say everyone should get vaccinated. I know those. But as many as possible is what we're at. So we'll continue to send that message going forward until you tell us not to. I'm speaking for Jay, I think. He's been using his platform and social media to do the same thing. I know that everyone is interested in talking about face coverings, so I placed it up front, and it's most of what I have here tonight. And I'm working from that document, the DHHS toolkit for schools and child care. Last week. Yeah, there are copies here. Hopefully some of you have copies. If this is two important purposes of face coverings, one is to protect the person wearing the covering the mask, and the other is to prevent the spread from the person wearing the mask. Everybody, I'm sure, is aware that the American Association of Pediatrics and Centers for Disease Control have recommended universal face coverings in schools. They've done so due to the national transmission rates of Delta variant of the coronavirus. Italicized and bolded the words national, because we're not the nation. This board makes local decisions for these communities, not for the nation. Schools and child care programs in New Hampshire can recommend or require face masks. So statutory authority to do either thing. You're counseled by DHHS to work with your community, decide how to implement face coverings in order to prevent introductions of COVID. So there are 4 factors that DHHS suggests you look at when making decisions about whether or not to require or recommend face coverings. I'm going to talk about these 4 things in order, and I hope you would have done that. I'm trying to make this really make sense. There are copies of this around too, and this will be on our website by tomorrow. So number 1 is the level of community transmission. The New Hampshire Department of Health and Human Services recommended that if transmission becomes substantial or high on the county level, to consider tightening mitigation measures. Some have interpreted this to mean that if transmission is substantial or high in your county, that you mandate universal masks. I'm going to get to that. It's not exactly what they said, but it is one of the options they're laying. And also there are 4 factors you're thinking about. Level of community transmission, and then I'll talk about the other 3. So this is one of the 4. How many people are sick and how rapidly is it happening? Community transmission, what does it mean? It's a combination of 2 things. It's changed a little bit over the last year. This is not exactly what the definition was when we started all this, but as of now, it's really 3 levels, not 4. It's low, moderate, and substantial / high. They've kind of given up on the difference. The first thing they look at is new cases per 100,000 in population over the last 14 days, which is a lot of math. Go to the DHHS website. If you go to their website, the numbers are there. So they've done the math, they do the calculation, and if your county has 10 cases or fewer per 100,000 people over the last 14 days, that's considered low transmission. 10 to 50 cases is considered moderate, more than 50 is substantial. That's one of 2 considerations. The second is test positivity, not using the rapid test that we provide for Walmart for $20. Now it's only the nasal swab test that takes a few days to get the result. The number of people, so it's a percentage made up of the number of people who get positive results from that test, divided by the number of people who have taken those tests over the last 2 days. Again, a bunch of math that DHHS does it for us. It has this dashboard. So if your test positivity rate is under 5% of people taking the test, that's low, 5 days, moderate. The current numbers put in there, you can see them right underneath the definition and above low, moderate, substantial, high. Those are our current numbers in Belknap County. So in Belknap County, you'll see there's a strike through the number. That's because it took me a couple days to put this together and it changed. So yesterday morning, new cases per 100,000 in Belknap County was 143.5, and by the time I drove home last night, it was 195%. Test positivity in Belknap County was 3% in the morning, 4.4% in the afternoon. Now, 195% is considered high. It's above 100. So that's high transmission. But 4.4% positivity is low. You have high transmission and low test positivity. And what does that mean? And again, DHHS on their website does this for us, and they say that means substantial. And again, I can go to that website every day, and this is what DHHS gives us. So Belknap County, I'm going to talk about Belknap because it's an arbitrary group of towns, one city. So as of yesterday, this was the data according to DHHS, data I have access to. in the towns that comprise Belmont. Alphabetical order, it's all in Mark said right at the top. So let's keep this up. It's interesting to me that the county and the state rates are similar. 194.2 statewide, 195.7 for this county. The fact that town by town is so wildly different, I think a math teacher would tell me that's a sample size. This is what the state map that DHHS gives us access to looks like. So I took this screen capture yesterday. On the left-hand map, the lines are by county. So you highlight which county you choose. So I highlight that county. It gives me the numbers I just gave you. 195.7 new cases per 100,000 population in the last 15 days. And 4.4% positivity. And you can do this for any county, and then in the middle map of the state, that's my public health region, which is just a different arbitrary collection of towns. Our public health region is the Winnipesaukee region. It's a little bit bigger than Belknap County. It goes over to, goes farther north into the other side of the lake, and it also goes a little farther west. But there is no reporting from DHHS. See the map on the right? Those are the towns. Notice they're gray. That means I cannot get this data town by town. So on the previous slide, I figured this out. I did that. Create those. Not going to do that. But I can do it periodically if that's going to be helpful. That is something that DHHS is not going to do. And that's why that's great on this. So, look, I've talked about levels of community transmission, and now I'm not talking about what it means or what's recommended. We're going to get to that. I'm going to talk about all the factors first, okay? The second one is cases, clusters, and outbreaks. Again, that same document issued last week, DHHS writes, you have a cluster or outbreak in your school, and we'll help you. That's what DHHS says. DHHS told us they'd help us last year, too. In outbreak situations, DHHS might recommend quarantining close contacts. They might recommend additional cleaning and disinfecting, and they might suggest other protocols for case identification. They might tell us to close the schools and have the kids remote learn if we have a big enough outbreak. But you need to get to a level of outbreak where DHHS says, okay, now we have time to help. When we have a few cases, we're on our own, we know that, we learned that. So here's a little more detail. These are their definitions, again, out of the same document. You can Google it and find it online if you want. There are copies here. Low levels of cases, they're sporadic, and there's no evidence of transmission within the school. That's what we experienced while we were in school. What we were doing was, those of you, again, kids here know, we turned the place upside down to try to create protocols and mitigations of infection. And we didn't have moderate cases clustered or outbreak is multiple cases comprising at least 10% of our students. So for us, that's 40 kids in this coming year. Would have to be sick for us to meet that definition. Or let's say we have a classroom and a big percentage of the kids in that class all got sick. That would be considered a single cluster, that class. And what DHHS would have us do is treat that class separate from the rest of the building, and then do whatever either the board decides or DHHS tells us about. And then, of course, science when that's not multiple clusters or groups. So how can we respond? Well, if you have individual cases here and there popping up, you do the things we've been doing, environmental mitigation, which I'm going to talk about next December. And we've done a good job of those things here. At least I think so. Provide rapid testing to anyone exhibiting symptoms. That's something we didn't do at the high school last year that we're prepared to do this year in Portsmouth. If we have moderate outbreaks or clusters, meaning that one class or a couple of classes or a little group, or maybe it's a team, that group could go remote for a period of time. Maybe it's only a week, maybe it's 2. One of the things this says is that PMHS is telling us this year, and this is a change, that close contacts to a positive case who are not household members of that positive case are not staying home in quarantine. That was a big thing this year. All year, nurses contact tracing cases and then calling parents, maybe some of you, and saying, look, your child has been identified as a close contact or potential close contact, now has to stay home. This year, DHHS's guidance is that close contact, if they don't have symptoms, will be required, in this case, for face quarantine. Or until they have symptoms, in which case they're going to stay home. And then in cases of schools with high transmission and outbreaks, DHHS will tell us what to do, and I think that's going to include some work to do that. Last year, we had everybody complete a little screening every morning at the high school. Do you have a sore throat? Do you have a fever? Do you have a headache? As long as they said no, they could show that's on the way in. My recommendation going forward is that we don't do that for a high school or only a high school. People here should be able to understand if you have symptoms if you're sick, stay home. If somebody shows up, staff or student, doesn't really matter. If somebody shows up who has symptoms, listen. Still in cases, clusters, and outbreaks, I would suggest tonight that with 8 cases currently, or as of yesterday in Alton, and some number between 1 and 4 in Barnstead, because DHHS doesn't tell us the number, what was that number, just give us that range. We should assume that among the school, our students and teachers that we would be welcome. We don't have. We don't know this for sure, but given this information, that there are only 9 or 12-ish people in these 2 towns currently with coronavirus, I think it's safe to assume in the local. So that's the second of the 4 things that DHHS says to think about. Maybe this is about face coverings. The third thing, and I think this one's important for us, is the school's ability to implement other prevention strategies. So this should be good for us. Is my suggestion here to you tonight going forward. Because you kept this 4x4 schedule. I understand everybody wants to make like it or things I don't like about it. I'm sure things are principle. That's not the point. What it has done is allowed us to limit the number of people everybody comes into contact with. Because instead of having 6 or 7 classes, students now have 3 or 4 classes each day. By definition, they're coming into contact in those classes at those sustained periods of time. Fewer people while they're here. You can't control what happens after they leave while they're here. That's something that's built in. It's in the structure of the school, at least for 1 more year. The principal and his administration came up with a plan to have 3 lunches during the day. And again, with reduced cohorts, plenty of room, we put in some outdoor seating, there are plexiglass tires on the tables. We think it's a pretty secure environment during lunches, when regardless of whether the student wants to be wearing a face covering or not, they can't. We have those extra things like plexiglass on the tables for those times. With these mitigation, I didn't talk about HVAC. The fact that this place isn't out, and everything works. That maintenance has been done here over the years. Filters get changed. We have a functional HVAC system. We have a building, and not every school can say this. We're building a course, which means we can exchange the air. Pass our air performances, flying colors. And that's something not all schools have, so that's a strength. Other schools are having to think about this. We don't. This is something we can do. We can keep the air in here moving. So last year, these are the mitigation protocols we had in place. We had 13 students who were attending school get sick, and we had 8 students who were not attending school get sick. They didn't get it here. In fact, we believe that none of those 21 students was exposed because of all of the mitigation we had. So here are what those things are. Again, there are printed copies of this and more. This is review at this point. We've been doing this now for a while. Physical distancing, because of the schedule and the structure of the school, in most of our classes, we'll be able to maintain well over 3 feet of physical distancing in each of the core academic departments. The maximum class size is around 20. Those would be 3 feet of distance. For my daughter, I recommend that she wear a face covering in that class. In many classes here, in the average class here, with 12 to 13 students in the room, we're going to be very close, if not at 6 feet of distance, which is when PMHS and the CDC get to set aside for a moment. That's what they would say you can take off. Plexiglass barriers, I've already talked about. In addition to having them in the cafeteria, we can hand them out. We have only ones we can provide for anybody who wants. Limited cohorts I've talked about, so I won't again, and same with ventilation. Cleaning and disinfecting I referred to. We have a system. Last year, for any students who may be in the room, I'm sorry, it was new, and we were all doing the best we could. We had students and teachers wiping down the hard surfaces in the rooms at the end of every period, disinfectant wipes and things like that. The guidance we have now is very clear that we shouldn't have to do that. Just clean at night, and we disinfect regularly. That doesn't even mean every night. These disinfectants should be good for at least a week. That should be adequate. We promoted hand hygiene and hand washing, things like that. And then the last thing, and I think this is pretty important, and I see that you're all here, and I know what that might mean, but I don't know what it does mean until you talk. But we have a lot of support. Kids in the building did what the principal and his staff asked them to do. Parents supported the school. It worked. So we expect to be able to physical distance with personal protective equipment and plexiglass dividers we have in the school. We think that our ability to implement other prevention strategies, one of the 4 things PMHS recommends we think about when making decisions about face coverings, we think our ability to do this is very, very good. And then the 4 things is the level of vaccination within either the school population or the surrounding towns. And again, I'm going from the same document from our Department of Health and Human Services last week. First, promote vaccination, talked about that. And then highlight the level of vaccination, the vaccination rates in our towns, and then if we know it, in our school. So the current rates, as of yesterday, are 55% in Alton, 45% in Barnstead, and we're not sure. And I gave you the number to be guessing, because we're not really asking. And we're certainly not requiring anyone to tell us if they're vaccinated. But if they choose to tell us, it gives us information that the board could use to help make decisions about things like whether or not we might require face coverings. At the bottom, again, a quote from the Department of Health and Human Services. They recommend a goal of 80% of the population. So how these 4 things interact is now, it's a matter of now to, and I know there's more going on here than face coverings, but we all know over here. Right. This is one example provided by the department, PMHS. One recommendation, it's not a recommendation for schools. It's an example. And it uses 2 of these 4 factors to create a matrix that would help you make these decisions. As of yesterday and today, even school boards that a week ago had met and voted to keep face coverings optional this fall, rescheduling meetings and starting to adopt this. I've been reading emails all day. Today, if this were the model, we're in substantial transmission. Everybody remember that from the first of the 4 things? Belknap County, we're in substantial transmission. So in this model, that would put us in the mandatory universal face coverings side of the thing. It does, however, only consider two of the factors, level of community transmission and cases within school or facility. You know, that we're low, right? So we're at the top. It could be green if we were using this matrix, because we don't have cases, right? We have about a dozen cases in the two towns. We don't know how many of those need to be in the school, maybe none. So we know that we're at the top in that factor. But community transmission in the county is high, 195.7. That puts us all the way over on the right. But Ben Chan, who's the chief epidemiologist for the department, is very quick to then say there's no requirement of this. And it'd be a framework to help you think about how to think about this. It's not all about the county level of community transmission. It's also what's happening in your communities. And then again, from Dr. Chan on the same day, when an entire community gets to a certain level of transmission, whether you have cases or not, there's more risk. It reminds us that COVID-19 is widespread nationally. So using PMHS's model, how to think about these factors. Here's another one that we use all four of the factors. We have a substantial or high transmission rate in the county, but we don't have cases of clusters in the school. As far as we know, we have a low vaccination rate because the two towns are in that 45 to 55% range, and we have no idea in the school. But we think our early protocols in the building are very good. If the board wanted to create a matrix like this and say, look, in high school, everybody's over 12, so the opportunity to be vaccinated exists for everyone. And the opportunity to put on face covering exists. Right? So you've got two layers of protection available, should you choose to use them. And in that environment, I'm sorry to do this to you, but this is what happens every once in a while in the school board. You can choose. You have discretion about how you want to do this. It's a community conversation. One way to think about it would be, well, if we accept two factors that are in the red, that are on the high, and then we keep an eye on the others, I think we're going to continue to be good at building mitigation. But we watch the number of cases. If we were to come back to school this way, vaccination and face covering all optional. At this point, everybody knows they can go get vaccinated. If we did that, and then started to see clusters pop, then that factor would start to drop down, right? And if we at some point had all three of those things in the red, maybe that's time to make a change. But these other things could change too. Transmission rate in the county could lessen. Some point. Our vaccination rate could increase. It's an option. I'm not going to go so far as to say that this is my recommendation to the board, but this is an alternate way of thinking about this if that's something you do. So decision number 2 for the board is regarding face coverings. Those are talked about probably longer than you wanted me to about the 4 factors DHHS recommends. So decision number 1 is, as of tonight, at the beginning of school, face covering is going to be optional or they're going to be required. And then how will you or I decide when to change that? Do I have a system in place? Or when something happens, you want me to call you and say we have to have a community? Or do you want me to use my judgment? I have a little bit better than that by the time you're done. A couple of other notes. That's the bulk of what I have here, because this is really, let's face it, this is about face coverings first and foremost. There's a remote option in New Hampshire. It's called VLAX. We've been saying this since June. Anybody who's called in to our guidance department has gotten this message that a student who wants to enroll in VLAX on a full-time basis can go do that. message that we've been getting is that the vast majority of students will be in school. We're going to be here 5 days a week. That's the plan. No flex day on Wednesdays, none of that. We are maintaining the 4x4 block. Again, I think that helps us. The building itself as safe as possible. The periods are a little longer so we get some more structured learning time. This one could be possible. If the board decides some kind of system where we're keeping track of all 4 of these things, and vaccination rate is one of the things that's helping them make their decisions. If people are willing to voluntarily tell us that they've been vaccinated, that helps us keep track of that number. We can always ask, just can't necessarily require. And that can help. All of our classes are running in Google Classroom, and they'll continue to. There were times last year when every single teacher, I think, that's delivered content remotely, at least for a day, if not for longer. So they're ready. And if the board chooses that risks some outbreaks, and that means we have to send groups for the school into remote operations for, again, a week or 2 or 14 days, we have the ability to do that. Even while we're here in person, be in a format that allows them to go. And then the last note I have here is that it's my fault, I wrote it. Then on June 29th, all those goals, those 5 goals on the very first slide, are based on anticipating that professionals are going to continue to remain this summer. We need to hold this. Students back to the kind of year they're accustomed to under normal circumstances. So that illustrates the point that it changes and it'll change again somehow, one way or another, or different ways at different times. And we need to have a system established to revisit things on a regular basis. Depending on what kind of matrix you want to use, I can keep track of the data at least on a weekly basis. At least the data follows. So if it's this, right? Something like this, recommended by DHHS, I can put a circle around where we are and listen to data and make that a public announcement. If it's something locally developed that's a little bit different, I can do the same thing. I can report the numbers as weekly as you want. I can do it more often or less often. Whatever you want. So decision number 3 for the board is, do you want to have more meetings, or do you want to tell me to do it? I think I know the answer, but it's your decision. And then, if there is a change, if you were tonight to start with still like trying to do the school, as we said, everybody having the option of wearing face covering if they choose to. How do I know what to do if the data gets worse? Right? Do I come to you? Do I treat it like a snow emergency and make a decision for a limited period of time and then come to you? What do you prefer? When we did this the first time, our goals were different. There was a much greater acceptance, not only here, but across the state, across the country, that the limitations we were putting in place in our schools were going to stay that way. Right? We expected to have those things in place for a long time, if not a year. That's kind of where everybody was coming from, but that's not the case now, right? We want to be done. But we want to be. So when the week or the day comes that we can either loosen up or that we need to tighten up, whatever it is, we should at least have a conversation about how you want to do that. And you are allowed to just tell me to go through that. And this is my last slide, because I think it's the most important message. There are community decisions to be made here, so there are some recommendations in there, and if you want a little bit more, I'm happy to share. You know, you asked me during your discussion, but well, it's too, so I'm trying to keep framework around this conversation.
Hello, my name is Jason English. First off, I gotta say thank you, community, for showing up here today. You might not all agree with me, but looks at it, you might just. It also looks like my work is cut out for me, so let's get right to it. I'm not going to deny that vaccines work. I'm not an anti-vaccination person. I believe that if you are elderly, if you are high risk, you should get vaccinated. This virus kills old people, so please don't think that that's where I'm coming from. Okay. I definitely want to thank all the teachers and the staff, the parents, for all the work that we've been putting through. The teachers and the staff, you guys have been putting through so much stuff within the last 18 months. It's absolutely mind-boggling that people still have their heads on their shoulders. It's absolutely not easy for me to share. I do know what tragedy looks like. I almost lost my oldest son to a car accident where he suffered a TBI, where he is high risk to suicide. It's not a vision I'll ever get out of my head, nor will my family ever get that out of their head. It was, I also want to make a statement that I also understand and have witnessed firsthand what respiratory illnesses can do and how people can suffer, and it is not the way to go. And with that said, this needs to be done. Just so we're all on the same page, we originally did all this for our elderly. We can't go back to normal today because our children are at risk because they don't have available vaccine. Children are now in danger because of the Delta. And for slides, cases, transmission. And the problem with listening to your government tell you where to look all the time is the fact that you're not looking in the places that you maybe should be. That is why I am here today. So, let's review some facts, some data, some science that is not fake news. My stuff is coming from CDC, just like yours. And if you can bring up that first slide. The first slide is for 2019. And I think it's important that we look at the death totals over here. And, I got to say right now, this is absolutely horrible that I'm up here minimizing tragedies like this. But unfortunately, life needs perspective sometimes. Okay, so we're going to go over this. 1 to 4 years old, influenza in 2019, 122 little babies dead. Assault, homicide of a 1 to 4-year-old baby, absolutely horrible. But the big one is look at those accidents up there. Proper car seats, everyone, please. The police are over here. They will help you with that. The fire department is here. It is so important. The next slide I'd like to show you is ages 5 to 9. Again, I'd like to point out only 52 deaths for the flu. Look at the heart disease. Again, assault. 155 kids dying of assault, man. It's absolutely horrible. And all these things I can't pronounce. Sure, that's cancer, right? So, again, accidents, very big number. And here's the tragic thing that's not highlighted up there. And it's worth putting out. Is look where it starts showing up. Right at that number 12. That would be suicides. 12 suicides, 5 to 9 years old. Okay, 2019. Next slide is going to be 2019 age group, 10 to 14-year-olds. Again, influenza, 71 deaths. Heart disease is good. Assault, homicide, we're getting up there, and look at what is in purple. This is 10 to 14 people. 534 suicides. Tragic. And this is what happens when we start losing support systems. Okay. Next slide.
My name is Chris Ridley. I'm a taxpayer. Deal with my case.
Do you accept?
Well, actually, I appreciate all the data that you collected, but we're here to talk about face masks for COVID.
Ma'am, I'm going to get to that. I have more than enough people here that would be more than happy to listen to the data that I've worked so hard. I work 6 days a week. Okay? I sometimes work 13-day work weeks. I've stayed up very late on my work days. I work 10, 12 hours a day, but I'm making time to be here to make sure that you guys have the right information in front of you. You're going to accept this 5 minutes that is being yielded to me?
I'm sorry. It doesn't really work that way. I'm not cutting the clock.
Ma'am, I am getting to that. I am trying to set the stage for you so you guys all have proper knowledge to understand what's going on. Right now, today's society, I'm being accused of the one fear mongering because I'm talking about whether or not you guys have the right to mask our children, whether you guys have the right to socially distance our children, put them in no cubby, eat their lunch. All right, this is Nazi Germany re-education camp crap, and I'm not going to take it. I'm going to give you the data that is shown by the CDC, okay, and other doctors. And I'm not trying to be a confrontational officers, but I have more than enough people here that's giving me their 5 minutes of time, and I believe that's why those limitations of time took place, so that every single one of these people have an opportunity to speak, and I believe that they are giving me that opportunity to speak before them.
I'm really here to make decisions on policies for this.
Ma'am, if you don't have all the information, you cannot make proper, informed decisions. Please allow me to finish instead of wasting all this 5 more minutes arguing. I just want to give you my case. And then, if I'm the laughing stock of Alton, the laughing stock of Barnstead, then so be it. I just want you guys all to have the proper information in hand, in context, because very much, ma'am, I'm getting to my point.
I'm not trying to argue. I'm trying to ask you to get to your point, and I will give you 5 minutes.
Okay, So, let's move this right along, shall we? Since we wasted 5 more minutes. We have up here another chart. I don't have a desk over here. I can't put my stuff in here. It takes time for me to put my stuff over here, just so that you're aware. Okay? Again, let's look at this chart right here and let's put some things in context. We remember the totals of the deaths, people, right? We got 1 to 4 with 122 flu deaths, right? These people are trying to tell you that your children are in danger, okay? Your children are at risk to die over this virus, and unless we stop it and we continue doing what we're doing, that we can't go back to normal until kids are approved. Not even fully approved, by the way. It's emergency use only for kids 12 and under. 1 to 4, 22 deaths. COVID-19. You see that number right there? That is 2020, the height of the pandemic, absolutely no vaccines available, 24 deaths of COVID-19. Are you a 4-year-old in danger of COVID-19? That's out of 3,469 tragedies, only 24 of them are COVID. 5 to 14, 123 deaths from the flu. Guess what, folks? The flu is deadlier than COVID. 14-year-olds who are at 67. I want to make a point over here that again, this is an old person, elderly pandemic, and look at all the death totals of those numbers. Now, on the left-hand side, okay, above 85, the age of 85, you have over 1 million deaths. 1 million old people die. Okay, I'm sorry, really sorry. My grandmother's 95, guys, I love her. Okay, let's talk about this. I too, Tim, pulled up numbers. Okay, this is really, really eye-opening, sir. Really eye-opening. Every American citizen right now should be absolutely outraged. From the beginning of this pandemic, 0 to 17, 354 deaths, that's less than a child a day. I'm pretty sure just in my 10 to 14-year-olds, we have more suicides per day, which is very relevant in what we're doing to our children by sticking them at home and trying to. You have COVID, you're home for 10 days. Mask might be mandatory again. We got to listen to the CDC. Everybody over here wants to sit here and tell me that I don't have an idea or an educated approximation of what these people are going to think and do, when all we have been doing is following CDC guidelines. Okay, CDC guidelines. We all should be vaxxed, right? Whether we're vaccinated or not. Fact of the matter is we got another doctor over here from Dr. Marty Mallory, Johns Hopkins University, pretty well known, and he is equating this now to, let me quote him, that there is a lot, and I quote, there is a lot of good news out there, and I think people need to hear the good news right now. People have entirely distorted the perception of risk. The fatality rate of COVID-19 in the U.S. is much different than when it started. Right now, we've got 1/50th the number of daily cases of this virus, which compared with cases of the flu during the mild season of the U.S. It's the flu. I'm showing you evidence, folks, that this is just like the flu for our children, okay? And I'd also like to make another point that if we continue to hide our children, and you guys think that the Delta variant is deadlier than COVID-19 originally was for children, then I think I'm making a pretty good case that some of the policies that we're putting in place might just harm them a little bit. Because I think I'd rather my kids take their chance with this bug than the other bug, but I'm not afraid of the other bug, okay? Mental health is a very, very real thing. I believe every single parent out there, when this pandemic started, we reached out to mental health experts to try to help our children cope with this. And all we found was they were all busy and they were all booked up months in ahead. And I really, I found out that there was a lady who's been in the ER because one of her daughters decided that she wanted to eat her depressants because of the fear mongering that society is putting in place right now. And I'm here to stop this. This is absolutely ridiculous. We cannot terrorize our children. That is exactly what we're doing. We are instilling fear into our children. And it's not okay. It's not okay. It's child abuse, guys. Come on. This is not okay. Yeah. Let's get to Dr. Fauci. Dr. Fauci said, and I quote, that losing American citizens' rights does not concern him, that only stopping this virus does. And let me tell you right here today, I do not recognize the CDC as some authority or excuse to allow the rights of our children to be trampled. This isn't political. I got a thing over here for you that might just put things in perspective of this pandemic and previous ones. So far, 350 dead children. Tragic. Chances are they probably were high risk, and any infection probably would have killed them. H1N1. We did nothing. Matter of fact, most of the population forgot it. But yet, 1,090 kids were dead from H1N1. I didn't vote for Obama, but I'm telling you right now, I absolutely 100% agree that he should have done nothing. Okay? Because sometimes you do more harm than good. Can I get a third?
No.
Ma'am, I'm not done.
Well,
Ma'am, respectfully, I'm here, I work my tail off to get this stuff to you. Okay? I was up till 3 o'clock in the morning most nights, going through my stuff after working 12-hour days to advocate for not only my children, but all of the silent parents out there, all of the teachers that are feeling peer pressure right now on whether or not vaccines are appropriate or not. And by this data right here, the fact that few of kids are dying. One more thing, 94,000 cases of COVID, right, for children contracted COVID. Again, in perspective, people, 354 deaths. There's more suicides than that. We have got to take care of our children. Ma'am, I'm almost done. Kids, ma'am, I'm almost done. Kids, I want to tell you right here, right now, that I am sorry. I'm absolutely sorry that it took me this long to summon the courage to stand up here and do what I am doing for you. I also want to know that want to let you know that your community loves you. And despite all the noise that people are listening to today, it is going to be okay. You all have long lives to live. And we are so proud of you. You hang in there. And if you feel any mental troubles, you reach out to somebody until somebody answers you. Parents, today's our duty. It's a duty to our children. Alone, I'm powerless. Together, we end this. This pandemic is over. There is 3 vaccines available for everybody. Our children are not high at risk of death. And if you want to talk about underlying conditions, about whatever, we can go there. Because let me tell you right now, on average, RSV kills 500 children a year causing influenza. In 2017 to 2018, the flu season killed almost 600 children. I know, misinformation, fact checking, it's not allowed here, ma'am. It's not allowed here. There's free speech. We have rights, and you're not going to tell me. And I'm going to ask you to allow me to speak for all these people that have yielded me their time.
Excuse me, if they want to speak, they can come to the mic. I'm asking you to start.
I'm Mary Starr, I'm a taxpayer from Barnstable, New Hampshire. I am a mother of 4 children. My time.
I said no.
I'm yielding my time to Mr. English. I agree with what he's saying and trying to share the information with you for people that have I don't know what you think that thing on her face is, or if you think you're gods, but nothing can stop a virus except God. So are you gods? Are you 13 gods up here? Mr. English has some information. I would like to hear it. As a taxpayer, I am owed that. I pay taxes in this town, a lot of money for years. I want to hear what this man has to say. He has spent a lot of time on this, and you should want to hear it for our children.
We actually have made a exception, allowed him to bring his presentation. Unfortunately, he's not following the presentation. He's all over the place. Now, if you would like to speak, we would be glad to hear you.
I'm saying the information that Mr. English has is something I would like to know as a grandparent. 4 children and 5 children. Pass on which causes them to have knee breakdowns. Their oxygen is being reduced. How is this helping them? Please tell me.
And can I remind you that you are an elected official? You are elected school board members. Therefore, you represent us and everyone in this auditorium. And our wish is what you are required to carry out. Our wish is that you let Mr. English speak.
That's to say, you should also, you have children. You're children. Did they? Easy to know. You have your child, let the children have theirs. And I yield to Mr. English.
Excuse me, I heard enough from Mr. English.
And not quite done yet. Unfortunately, these officers are going to have to take me out of this building because I'm using these people's times.
I guess my question would be, you guys advise us on masks in school and NHIA.
We're actually going to the applicant, get further on our agenda tonight.
Okay, so that
It should
decision.
be all in the,
Perfect, thank you.
Madam Chair, I am State Representative Paul Terry from Alton. This is not my 5 minutes, but I'd like to point out to you, and I'd like to ask you to extend a courtesy to the body this evening, based on the precedent that is set in our form of government, in the United States House of Representatives in Washington, D.C., in the United States Senate in Washington, D.C., in the House of Representatives in Concord, New Hampshire, where I serve, in the New Hampshire Senate, where I serve. It is a practice, a courtesy that is extended to members when there's a time limit per member. If a member wishes to yield part of his or her time to another member, that is respected. And I'd like to ask you to extend that same courtesy based on the precedent that we have in our United States and New Hampshire forms of government. You do that?
He was giving it, he was presenting to the school board.
I'd like to get back to my question. And will you extend that same courtesy that's extended in the United States House of Representatives, the United States Senate, the New Hampshire House of Representatives, and the New Hampshire State Senate? I don't know, take a moment here, you apparently have to read a note from the person next to you. But how about extending that same courtesy that we extend right throughout our country and our government? This is a governmental body, this is a public body. Can you not extend that same courtesy that we do all throughout this country? Yes or no?
No.
Thank you, just going on record, and you will be held accountable for that.
I'm going to have to close the public input. The purpose of public input. We are in public input, and I'm very willing to listen to different people's views. I tried to set a time limit. I've been courteous and extended that more than once. Now, other people have information that they would like to provide us about decisions that we're going to take tonight, whether or not masks should be mandated, or we have to defer any decision making to the superintendent in the future if things change. Those are the decisions we're going to make tonight. Now, you heard me today, I hope you did, that the board had already taken action earlier this year to waive the mandatory vaccine. You don't hear that?
I'm pretty sure that young lady right there said that you're going to potentially change depending upon how treating and cases and.
I don't know who was voted, but that was on board and said and done. The school board has taken no statements. The school board has taken no action. The school board is here tonight. What the nurse said is not representing the school board. I get you, but I'm letting you know, we tried to other tools, we have taken no action. That's what we're here tonight. So I know. Work said work needs to execute that. 6 o'clock, elementary, post on our website. Meetings, public meetings under the natural law are also posted within 24 hours prior to the meeting. The law dictates that they be posted in 2 places regularly. We post more than that. So these postings are at the doors of 2 schools, the board, this school, the Point Barnstead Elementary. We also post at the post office and on. Look, and I'm out of order, everyone's out of order. It's confusing. We've got 2 towns with 3 school districts. It's a little weird. Let's figure it out. That's the New Hampshire one.
Are there other people that would like to speak?
My name is Dr. David Sprague. I'm a 1986 graduate of Dartmouth Medical School. I've been practicing emergency medicine for 32 years. I've served on numerous state boards and committees. I won't bore you with all of them, some of which are required appointed by the governor. I've been a resident of Belknap County for 25 of those 26 years. I want to thank the superintendent for that incredibly biased, one-sided presentation about the facts of COVID. Just to give you an example, nowhere in any of these slides did you give any credence to natural immunity from people who have previously been infected. It was all vaccine, vaccine, vaccine. Students can tell the nurse, if they want, that they've been vaccinated in order to help the school craft future policy. Nowhere did you mention anything about natural immunity from children who have already been infected. And we know natural immunity trumps artificial immunity from a vaccine. How do we know that? Nowhere in the world are any hospitals overwhelmed with patients infected with Delta. They previously had COVID. Lots of places are overwhelmed with people who have been vaccinated, yet now have the Delta variant. We know the vaccines don't stop the Delta variant. What's Fauci's alternative? Give them a third dose. That's like saying the guy I hired to fix my roof the last 2 times didn't do the job, so I'll hire him a third time to fix my roof. That's a stupid policy. But let's talk about masks in children. You're talking about doing something to a segment of the population, children, who do not suffer the serious consequences of this illness. The risk of a child dying from COVID is 1 in 2 million. 2 million. For those of you challenged by math, that's 0.00005%. 4 zeros and a 5. In the winter of 2017 to 2018, 187 children under the age of 17 died from the flu. Since we recognized what COVID was, that's 2 winters worth. Do you know how many children under the age of 12 without leukemia have died? 0. There were 6 children who died under age 12 and they all had leukemia. That gives you some perspective of what we're dealing with here. What you were talking about doing to children is
We are talking about children that are 12 years old.
I'm giving you statistics, ma'am, okay? Please don't cut into my 5 minutes because I know you're very, very uptight about that, okay? Let me give you some information about masks. Before you entertain a vote on universal masking, you need to show to everyone in this audience one study, just one, that shows that masks stop the transmission of a respiratory virus. I know you can't do it because it doesn't exist. The closest we came was the Danes did one, and it didn't show any benefit. Let me give you some personal information. When I was in my residency, we were rounding on an inpatient. I live in Gilbert, okay? When we were rounding on an inpatient with tuberculosis, someone with TB so serious they were in the hospital. So you're going to shut another speaker down. Is that what you're trying? Okay, so my 5 minutes just suddenly disappeared because other people. Would somebody like to grant me their 5 minutes?
We have not made a decision tonight. We made one back in June, and I'm not sure.
Made an informed decision as opposed to just listening to cases. When we're talking about the risk right now to our children, okay, we're talking about peer pressure right now on them getting vaccinated to make some of you feel better and safer. Okay, they are not, the numbers are showing that. And all I was asking for, with all due respect, okay, is to have an over here with as many parents that I've talked in here, okay, who have awarded me and not arguing with me, and arguing with my husband here, who just give you some facts, some science, all I've heard for the last 18 months is facts, science, real.
Because obviously my husband is one of our board and does not understand how public. And we have rules about public input so that we can actually inform and conduct business. This is not a deliberative session. This is not a public hearing. It's a regular board meeting. So typically what we do on an agenda is there's a public input at the beginning of the meeting, which is about agenda items, which is what we're heard about tonight. Typically, and this is the rules that are posted in meetings that are usually the agenda. We allow, it's actually 3 minutes, right now that are allowed for each person to public input, sure that everyone gets a chance to speak. And the board has time to continue with their meeting. We've actually extended that time. Section to say, we do get a lot of straight, but use the slide. It did not change the time constraints or other, it does not change the fact that the purpose of public input is not here from one person for the entire time. Stop. It is not. To anybody from the community who wants to speak. Gone. It's also not something that is required to stay on. And it is not the same that so much time to be able to speak. Something what it's about when you're trying to follow and give it as much description as possible. Still have to make decisions that we need to.
Ma'am, it is painfully aware to us that you are spending more time trying to tell us to shut up than you are to listen. Yes, you are. You wasted close to 15 minutes arguing with us.
See the meeting and hear from anybody else who wants to speak. And we will need to close.
All right, so ma'am, I'm gonna just, okay, because right now, this is about, right now, respecting people's rights, okay? And as a friendly little reminder, because I tried to come here last meeting, and it somehow moved to the library, there's no signs up showing where it's at. So, you know, excuse me if my session's a little bit long, right? But you guys gotta show us where you're gonna hide. Okay? If you're gonna be in here, then be in here. If you're gonna be in the library, let's post up some signs showing where we can go so we have access to you. But what I might be here, ma'am, I'm already telling you right now, ma'am, let me tell you right now, what he is giving you is a letter that is from an attorney who advises
I'm going to
is
close.
the Department of Education. Listen to me, man, I'm not. I'm listen to me. Come on, ma'am. Let me tell you right now. In the fall, you guys, you violated, who marked our children with X's on who is vaccinated and who is not vaccinated.
You do not have any right to impede on our children's rights nor mine. I had a nice little thing here, and if you would just allow me to remain still,
I would like to tell, please,
look, guys, I've got so many people.
I would. Listen, please. I'm going to close this public hearing.
And I have something else. I need to bring up to your team. Had you guys gone ran away from me and hid from me last month, I would have already made this up. Okay? So right now, we need to understand. This is notion. If our children, it is an excellent.
Stupid. I don't want to.
Public input by hearing other people that were standing in line, glad to listen to you, but if you continue to shout at the board, but I have to make this clear that you've made this meeting disruptive. Now, if additional people would like to come to the mic, I would be glad to hear from you.
Ma'am, I don't think I have spoken for anything close to 5 minutes.
Please do.
I'm a sergeant with the Alton Police Department, okay? So the board's trying to keep control of what's going on. If by chance the board warns you that you're disrupting the meeting, there's gonna be a disorderly conduct investigation. I've explained that to some of you. We all are trying to accomplish the same thing. Okay, so if by chance they warn you that you're disrupting the meeting, and they put me to task, it gets serious real fast. So it's all kind of fun and games back and forth. Well, if
they tell me they're disrupting the meeting, then I have to act. Does that make sense? That's my, that means the burden of the statute. That means the burden of the statute. You look up the sort of thing. It's mine, it's. Yeah.
Excuse me, you believe you spoke for about 3.5 minutes, but I will give you 4 minutes.
The gold standard mask used in healthcare is N95. None of you have an N95 on. What N95 stands for is it filters out 95% of particles that are 0.3 microns or larger. 0.3 microns is the same as 300 nanometers. The average COVID virus particle is 50 to 100 in size. Less than half the size and best of the pores in an N95 gold standard mask. The paper blue masks that you have on, which is what we typically wear in the emergency room, are even wider in terms of pore size. The cloth masks that you have on are worthless. It's like trying to stop a mosquito with a chain link fence. That's how poor these are. That's why there is no study anywhere in the world that shows that paper masks stop the transmission of a respiratory virus. When I was a resident, we were rounding on an inpatient in the hospital with tuberculosis. TB so severe, they were in the hospital. And being dutiful residents, we started to wear paper masks on. And the attending physician, the pulmonary specialist, looked at us with this look of derision and said, "What are you doing?" We said, "Put our masks on." "Why?" He said, "So that we don't get TB." He said, "Are you kidding me?" He said, "That thing is not duct taped to your face. If there's TB floating around the room, it's going to go right around the corner of your mask and into your mouth. If you want to use a mask to stop the transmission of a respiratory illness, put the mask on the patient." Yeah, it suddenly dawned on us. Quarantine the sick, not the well. Before you take a vote on whether to implement universal masking in this school or anywhere else you have authority over, I challenge you, you must provide the townspeople a study, I don't care where it is, one study that shows that masks stop the spread of COVID. It doesn't exist. Thank you.
This doctor is speaking really the truth. Your masks there are not doing anything to protect you. It's unfortunate that the science is there for that. So please look into the science. And I agree with you. Have a study. Could you state? Oh, my name is Judy Hudson. I'm a taxpayer registered voter in. I want to tell you right off the bat, the mask is not effective against COVID, the kind that you're all wearing. The other thing to consider though with masks is not just a mask, which somebody came up with about you have to have a mask. The truth is there's other things to consider. Children need to see faces, they need to see noses, they need to see smiles. People feel isolated when they wear a mask. You also can kind of hide behind your mask. You need to be out. You get skin conditions, especially high school students, which are really sensitive about that. You get less oxygen. I want you to know it's almost difficult to hear what you're saying because the mask is muzzling what you're trying to say. So as a teacher, that's muzzled. As a child, speaking is muzzled. So you get less oxygen. This is all proven. It's just hard to understand each other. And it is not necessary. It is against everything that I feel masks are child abuse. Yeah, the facts talked about. So please don't have masks without a scientific science that says that they are in yours and ours only in 95. That may help.
People problems. I'm Donna Cosmo. I'm a mom at a child care process, and 3 that I homeschooled last year, but in again in March this year. I'm not going to try to give you all kinds of stats and all that kind of stuff. This is purely anecdotal. There is one clarification on the data that Mr. Ryan presented. By the way, I was very impressed with the opening plan last year. It was excellent, and one of the In the numbers, the one thing I wanted to point out was on the grid. If we do implement a grid, like not to make decisions, which I think makes a lot of sense. If you have to hold a board meeting about what's going to be time to have to change, it'll all go ahead. But if you have a grid, my only thing I want to clarify is the community transmission. New Hampshire historically, I've been following this, I work in a nursing home in Coney, I work in a hospital, I work in a nursing home. We've been there doing this from the get-go. We currently have an outbreak of COVID in our building, which is what I wanted to point out. In Philadelphia, your numbers of 36 new cases. I can guarantee you at my last count, I checked with the nurses today, were that at least 15 of those are in the building. So you're not talking 36 people in Laconia all over the place spreading COVID. You're talking at least half of those in one facility, which we're dealing with. I mean, unfortunately, COVID is here to stay. I had a vaccinated nurse bring in COVID to our building. We had our first outbreak in July, who infected one of my dear patients, as well as several others, who infected me. I've been vaccinated. I was vaccinated early on in January to protect my patients, protect myself. I haven't chosen to vaccinate my kids yet, and they're not high risk. But again, I'm vaccinated employee forever, wearing masks and sanitizing. In fact, the vaccinated patients who infected and vaccinated me. I had a head cold. It was fine. I have coworkers who feel a lot sicker, even though they're vaccinated. I get it. I've had a patient that just today we found out was on care and comfort, and a patient just yesterday before we died with COVID. So again, I get all that stuff. But basically what I wanted to say, if you're going to make decisions and we respect it, I will put a mask on. I don't have to, but if the sign says on a mask, I'll put a mask. I respect decisions at the comfort levels. But in the grid, if you're going to make decisions going forward, just the substantial community transmission in New Hampshire is weird. From the get-go, over 75% of cases have been in nursing homes or in cloistered areas. No school outbreaks. My kids went to summer camp and did not wear masks. They're not vaccinated. No outbreaks. So again, kids aren't transmitting. I isolated from my kids. It was brutal. If anybody knows me, it's really, really hard to sit still, much less in a room. And I isolated from my kids. I was actually exposed to my kids for 3 days before I got tested positive at work, because I came in and said, I'm not going to stink guy, you better test me. And that was the beginning of our July outbreak. At least my identification identified it. And I thank God for that, because then we were able to test everyone in the facility as they stopped. And we found a cluster and we were able to isolate and not give it to my ventilator patients and everybody else. So it was good. It was good. But anyway, so again, if you're looking at community transmission, I would say in New Hampshire, that doesn't make sense. It may make sense locally, it may make sense in bigger cities and whatever, but most of our clusters are going to be clusters in isolated areas, especially nursing homes. I've had outbreaks in almost every one of our sister nursing homes this month. We were the last outbreak, and we're an outbreak among vaccinated. I mean, we have 90% vaccination rate in our patient population, and they're getting sick. So again, we have to look at it. At risk, get vaccinated, it'll keep your symptoms small. Patients are not too. I have like between the two outbreaks, 15 patients. That passed away, and they were very fragile. 10 people would give you over. But again, if you're going to do that, I do recommend doing a grid and making decisions around it. So, everybody can see that consideration. Hi, I'm from Hornston, New Hampshire. I'm at the wrong meeting, but why not? As of today, 1.4 million people live in New Hampshire. Currently, there are 1,700 current COVID cases in all of New Hampshire. There have been 1,395 New Hampshire deaths since it began, and 0 of them have been in the 0 to 19 age range. As of today, August 17, 2021, there are only 61 hospitalizations in the entire state. None of those are ICU, and only 61 individuals of 1.4 million people are in hospital. That's it. That's with the Delta variant running rapid right now. This in no way warrants masks coming back. In an article, we even mentioned several negative aspects of long-term frequent use. These are claustrophobic experiences, difficulty getting oxygen, increased heart rate, nausea, dizziness, headaches, provoked stroke, which impacts our immune resilience. Not to mention, it prevents the mirroring of facial expressions and enunciations for our healthy children. And me tonight, listening to you guys speak, how you can understand masks. More research shows that a nice mask may breeding ground for antibiotic-resistant bacteria and fungi, which can undermine viral immunity. The research advocates the use of medical and surgical masks that are used once and should be replaced after a few hours. This means a family of 2 children and 2 parents will consume 20 face masks a day. Who is supplying
impact for low-income families, because I know all families cannot afford this, and I know that schools can't afford to do that for all these children either. Furthermore, several studies show that long-term exposure to socio psychological stress that leaves neuro scars and are difficult to cure in young people and often escalate into mental and behavior problems and a weakened immune system. Isn't that what we're trying to avoid? Weakened immune system? A recent study by the CDC concludes that young adults 18 to 24 increase levels of anxiety and depression by 63%. If that's happening to young adults, imagine what it's doing to our adults and children's minds. A quarter of those individuals, of that 63%, have thought about suicide. Antidepressants have increased by 25%. That kind of science is what's scary to me. We are ruining our children with these mandates. So I'm asking you, do the benefits really outweigh the drawbacks? With that being said, masks needs to be a parent's choice, and that decision is not yours to make as a school board. Thank you for your time.
Yes, all of you, President. Where, what you mentioned that and children that I care deeply about. And the decisions that you're making are, as the superintendent stated, here to stay. While they can change day to day, week to week, month to month, the input that we put in here tonight and every night that we come in here is what helps you guys make these decisions. So I think it's very important that the people do get their chance to come up here and speak. While I respect your ability to determine what is disruptive to you, what is disruptive to me is not being able to go to sleep at night, worrying about people making decisions that are going to hurt my their future. So I just want to say going forward that I hope that we can take the time to set apart 30 minutes for one person. We have somebody else who wants to come up with a presentation that maybe we can set that time. Thank you.
That quick, here's around experiential within this system still, and two graduated from this high school. My daughter was during Thanksgiving, and you know, she told me it was like having the worst case of coronavirus, the sinus infection. The only thing that was worse was not being able to breathe. That was it. It's gonna be the worst. She said, she shocked, she just heard. But she said, that was the worst, and that's what she is completely fully recovered. This fact, two has since gone to physical stuff she has to do in the military on a basis, and that's going to happen. That's going to go as well. After that, so I mean, for yes, there are cases where we can find health issues. That's something that also works with children. The difference between a school year and a change in our students. What they did picking up is many of them who recognize their teachers. And as somebody that outside of school, their teachers in the past. That's where issues have to deal with, especially with as a whole, also things are not working in some cases along the top and any of our multiple jobs and for our teenagers. At the same time, we need to practice how to stay and experience. I can tell you that I need to if there's a chance that there's a big outbreak among students, start the school year, let it be optional. About their kids facade is regulated. Honestly, yes, zero cases. Every time you hear about these kids are so busy this summer, getting it off themselves. It happens. It happens. Here, the last year's meeting. And that is a least. Just to see that. And that's what this passage. That happens. Max, maybe see like spaces. Does not do that. Yes. Basically, some cases. They might have some issues out here. Where they're ADD or they're very shy. Study to draw to learn. But I would very much urge to keep it optional. Because the parents that their kid wants these groups of encouraging. Respect that most parents love. And respect the most public. It should never be created. It should never be laid down on students. I get it, you're gonna mark it, really like niches. It's because you that's just you know, but we don't do look out for each other. Do care about each other. Even though it's great to see here today. Review, maybe possible. Yeah, keep it optional, please. Right, next step. It's about five. Keep it optional. Let's look at this. Close in December, it's just great. See what goes. Yeah. Maybe see that. Didn't work today. Look at it. See how options are. See where everything's going. That's just not. Really niche, make option. Thank you very much.
My name is Sheena Lauren, and I'm an older resident. Number one is I want this decision to be. I will gladly sign a waiver for my child if you guys are. But every child in America has the right to a free public school education. And you need to take that into consideration. And I think everybody here tonight has told you they don't want our children back. So maybe you should take that into consideration. It is a personal choice. It should not be your decision, especially if you get up and walking out. Kind of unprofessional. So let that sink in because I'm pretty curious if you represent our school board. And second of all, is if you read the clause on the, it does say that it does not protect you against COVID-19. So why are you forcing it? How much funding are you getting to keep this going? Can you answer that question? I think not. My name is Eva Ryan. I thank you all for the opportunity, open public input for everyone. I know there was frustration. I know everyone has an opinion and perspective and wants to have the opportunity. I will say that I came to this meeting with my own preconceived notions and my mind made up. Opinion. I was incredibly impressed with the presentation from the superintendent. I wasn't involved in June, but I was incredibly impressed to see the 5 goals that were established on June. I applaud this for making the decision to hardworking mom, full-time working dad, incredibly belligerent, headstrong group of kids in my household. And it was hard. And I desperately want my kids back. I made the decision to homeschool last year because we're a high risk. My youngest has congenital conditions that mean that if he gets COVID, it's not just a, oh, sorry, you're a number. He's dead. So I know I'm not the majority when I say this, and I'm not trying to inconvenience anyone by saying this. But at the end of the day, the Americans with Disabilities Act, the Individuals with Disabilities Education Act, Section 504 of the Rehabilitation Act, all say, they all require that all public school districts ensure children with disabilities have free and appropriate public education in the most integrated and least restrictive environment. And what that means is that by saying it's anyone's choice, our family doesn't have a choice because of the potential risk and the potential exclusion. If we go back to the Stay Open Plan, the presentation said on June 29th, these will be published. And again, I applaud this board because they're fabulous. But the same presentation that the superintendent presented also outlined, our meeting was on June 29th. Since June 27th, active cases are up 876%. Hospitalizations are up 263%. And I know it's super easy to say those aren't kids, but that's not true with what's happening in Delta variant. Kids are being exposed, and this isn't a debate about vaccination or not vaccination. I encourage this board to be as flexible as possible, to use the grid. I agree with what this other mother from Homestead said about have the grid in place, have policies, have pressure to make it constant. And that's what we should do, because the situation is changing day to day. And even for those people who are not like our family, who are not a high-risk household, death is not the only option here. I work for a global company, and yes, we can say this is just New Hampshire, but I have friends and coworkers who have long-haul syndromes that they're still dealing with today. So let's just think about the fact that death isn't the worst thing that could happen, though death shouldn't happen to anyone when it could be prevented. So let's just think about those things. The majority of the spread that we're seeing today, according to vaccinated, the best precautions that he outlined, vaccination, mask screening, moving people with COVID, that was all part of the plan. And I believe, based on what I heard here, that if we asked the superintendent directly, his recommendations would be to say masks should be optional, based on the fact that he said there's maybe a total of 12 people in the two communities, which probably creates minimal impact. But again, I don't think this is a permanent decision. It's not that we decide today for the next 180 days. Let's use that grid and let's make sure we're keeping every kid safe. When we look at what's happening in the world, major corporations, Amazon, Microsoft, Google, my company, they're all deferring and delaying return to the office. Now, I completely support the fact that kids need to be in school. I'm trying to get my own kids in school. I also agree with the fact that they need to be able to have as normal interactions as possible. But I can tell you that my son's surgeon stood at an operating table for 12 straight hours with a mask on, and I assure you that his intelligence is still as stellar as it was on day one when he started his school. So let's think about that for a moment. I know there's a lot of different places we can get information, but let's just be smart about making decisions. And let's think about what the true risk is, what the true opportunity is. But let's not just make rash decisions. How do we Delta variant
is contagious and it's spreading like wildfire. If you watch the chart, sure, I watched the percentage of fatalities is dropping. No doubt about that. But again, definitely going to give me opportunity. So let's just keep that in mind. Please, I ask for your goals that you set out last month. Good. Let's do the best we can to align with that. But make sure that it's a safe environment. Thank you.
State Representative Paul Terry from Walton once again. This is not a customary position for me. I'm usually where you are, so this is a little uncomfortable for me. Although, as a pastor, I'm used to speaking publicly, and I'm used to speaking to people who don't always agree with me. They don't always agree with God, or at least what I believe God is trying to say to them. But there's one thing that we've all agreed on, past years, during the 39 years of my service to 4 different churches, 3 different states. And that's a word from the prophet Isaiah. It's actually a word from the Lord that he represented in the first chapter of his prophecy. The Lord says, and Isaiah represents in chapter 1, "Come, let us reason together," says the Lord. I deeply appreciate the heartfelt comments and passion with which each person has spoken this evening. But ultimately, I ask you, with the great responsibility that each of you has, to make a decision based on facts and wisdom. There are a lot of people who aren't technical experts. They have a lot of life experience. As parents, they have a lot of wisdom. I pray that I literally pray that you will listen to that wisdom and provide this district and superintendent with the flexibility to be able to respond to situations and circumstances here locally that dictate what would be in the best interest. And let me just say that I deeply appreciate the chair, Committee Dr. Strang, our dear friend and my dear personal friend, the opportunity to conclude his remarks, and for the enormous intelligence, information, and scientific facts that he brought before the board this evening, which I pray that you remember. Because in fact, if there's one thing that I can reiterate to you before I leave, despite the fact that there may be some people who are comfortable wearing masks, they can wear masks. Even if we weren't discussing this policy, the children would wear masks if they want to. You can wear a mask if you want to. You can wear a mask 100 years from now. But the efficacy, the effectiveness, come let us reason together. The effectiveness of masks, other than N95 masks, is zero. It's worthless. What kind of dystopian reality are we living in? When we are masking, when the masks don't do a darn bit of good, because the mosquito can fly right through the chain of events. There is not one single clinical, double-blind, peer-reviewed study in the entire world of the medical people. They're trying to, but there's not a single study that proves that masks are effective at preventing the transmission of this virus. So for heaven's sakes, don't make people do that because you'll be insulting them for heaven's sakes and their intelligence for heaven's sake. Let us reason together. Let us be reasonable and give the superintendent the nimbleness that he needs with the metrics he provided. And by the way, thank you, Superintendent, for creating Dr. Stein to talk about some of the perceived deficiencies and defects in your presentation. Not you, sir, but the information that you received and transmitted to us. Thank you. And thank you to the members of the board for listening to us this evening. And once again, I pray you will do the right thing. Because when I go home tonight, get down on my knees before my God and pray that that's exactly what you're going to do. And I'm going to trust that you'll do that. Listen, listen, listen. Be ready.
May I have another 5 minutes, please? Maybe 3.
I think we a lot of information, some from you, some from a few other people that have got done.
Yes, ma'am. And I'm pretty sure I just allowed everybody to speak unless there's somebody else before me that would like to speak again. I'm just asking for 3 more minutes. Thank you. We allow our liberties and our children's liberties, little by little, it will result in the loss of our freedom. The thing that makes us us. We will lose our identity. Can't be another Cuba, can't be Venezuela, because of what? Because of our unalienable rights. It is our duty as American parents to teach our children those civics and history and context so that we do not end up in situations like we are today. It is also happening a lot in our education system, and we really need to update our history and our civics and start teaching our children that a little bit more. Now, did you know that we were once from a dictator, a king, and it was some certain individuals in New Hampshire that broke away from this kingship. We first raised arms from our dictator. We are live free or die because we will never be ruled again. Before anything else, we need to guarantee this freedom for our children. And what you're doing right now is you're teaching them that their freedom does not matter and that their freedom is acceptable to lose based on other people's circumstances and other people's situations, which is not unalienable. Okay? Now, we have health privacy laws. Every single one of our kids. And when I found out that there was people marking children at a prom on who was vaccinated and who was not vaccinated, I was very, very upset. I would really, and many other inquiring minds would love to know where this idea came from. Was it the school board? Was it the union? Was it the CDC, DHS, whatever? It's not okay. And like I presented to you earlier, that attorney also states that it's not okay, and that parents, you are empowered. If this ever happens to your children again, you are to document it, you are to take pictures, you are to discuss it. I have plenty of letters to go around. I will post it on my page as well. But there is a number you can get a hold of that will that we can solve this. We can solve this together as a community. We can begin to heal as a community together without masks, without restrictions. This flu bug is never going to go away. Just like our superintendent showed you, the kids are fine. Now, I'm telling all of you that are on your school board, you're on notice. I'm going to do everything in my power to unseat those that want to harm my children. I am going to do everything in my power to do everything civically that I can to make sure that we don't have out-of-touch people up there making decisions and are making decisions that are not ethical. So today, I'm going to let you know I'm looking for anybody interested in school boards. We can train together, and we can make sure that we are represented and that our children are represented, and that is our duty as American citizens. Thank you for this last opportunity. I'll sit down and be quiet.
Actually, can give it to me. Thank you. Being that there's nobody else in line, I have those input or remind everybody that there is a second. Later on. Need a motion.
Make a motion to accept the minutes of June 29th.
Any discussion? Please. Anything else? All those in favor of that correction?
This is writing in the packet. And, price. Still, that's here funded previous year, so plus the was curious as to what grade please. So our kids forward, it's encumbered June 30th, hopefully to be installed for this season. This quarter, in that situation, just hopefully be shipped at the end of August, so. Paving's done, I think the line is still in progress. Yeah, they're here for the first. So the policy items in your packet are second readings and the from your last agenda. So there was a policy committee meeting prior to the June meeting, and you see all of these notes.
At this point, whether it's a 9th grade explaining the welcome back freshman orientation day, whether it's gone to classes as well, welcome back to teachers as well. We are updating the website as we can, as information becomes available and approved. We're waiting on a lot of decisions based on tonight's discussions. And once that happens, we'll update our necessary documents and between all of that material will go live on Thursday. And that's all I have. That's the question.
So I would add that Jay sent us, and you have in your packet, a copy of the protocols that his office shared with families at the meeting last year. These will require, I'm guessing, editing based on tonight's meeting, but they're here so to make whatever changes we want to make regarding the shared central office. Just a brief report telling you since this year is really on efficiency of operations at the central office. We're not spending our time thinking about how to change the way things work in the schools. There are principals and school administrators to run the schools, but we have a lot to do in terms of systems and processes at the SAU. We've been meeting weekly for the last couple of weeks. That's been a challenge for a number of reasons. So we're looking forward to this Thursday's meeting to make sure that we're on schedule. As of right now, we have all moved physically. Technology is working. 90 something percent, between 95 and 99% for each of us. Little things like getting access to a system. We saw troubleshooting with the IT folks from the 3 schools, 3 SAUs. And as far as the action out of the building, the Barnstead goes, we're going to take it right down the line. We have old records being shredding next Monday. We have long records being moved. There's trash being disposed of on Sunday, and then that'll just be some sort of moving. So I think we're on schedule. There's a lot to do, but we're doing it. The second item on my report, and there's a draft in your packets of a guide to electronic communication and use of social media for staff. This is something I'd like to address with the staff at high school on opening days. How people who work for schools use electronic communications with students is becoming more and more problematic in recent years, and it is always the responsibility of the adult staff member to draw the appropriate lines. It's never students' responsibility. So I'm going to take the time to communicate that to staff on their opening days in the friendliest way I possibly can, even though the real message is not necessarily if people do the right things. What you have here is a draft, it's a procedure, not a policy. I'm looking for your approval, but I won't put. So I'm going to take another run through it before I share my message with the staff also. I also included, for your reference, the Attorney General's guidance on the State Chapter 3, which is the divisive subjects law. I'm also planning to share this with staff in the high school on opening days. I think it's actually really good. It's pretty concrete. It's reassuring. It generally tells teachers who are good teachers to keep doing what they've always done. I think in the Attorney General's analysis, anything people have been afraid of in terms of what they thought this might mean. For the it's not what it is. Some people have been afraid of it. I think that's all it is. Well, so, as Chair's question, what happens if there's a violation of the guides that are social media? So it depends on the nature of the violation. There are certain things that you just can't do, and you don't get warnings for. But for small things, we hope for discipline with everything. So we have a conversation, we make sure patients work, rules work, and the same person, the same problem again, probably send a letter. We already had a conversation, and explain that this wasn't okay, and make sure that they knew what we're talking about, and then I'm trouble to see if they're doing it again, and then if they're So I think, at it, the draft we have here does include policy references. Yep. So the last time I went through this, what I tried to do was make the policy references a little bit more generic so that it actually applies at any of the three schools. In case I posted this message in all three schools. There is one high school specific policy referenced here. It is the anti-fragmentation policy that you approved about a year and a half ago. It's on the front page. There you go. And it says high school because that policy exists in the high school, but the other policy references exist.
Right, yeah, I was also thinking this guy.
As a dash. Well, if you do that, then I'm required that we. So it's up to you. I'm sorry, I didn't do this in writing for tonight, and I apologize, but I have actually shared with the principal and a few others, including a facilitator, who would like to bring it to both report through this, a draft schedule. We'll have a meeting first time here this month. And then again, monthly September, and the final meeting of the very beginning of December. In between those meetings, if they want to, and I anticipate that they will, give them the opportunity to send some people to visit a couple of schools. This would be after they get out some of the kinds of schedules that are interested in getting obviously maybe a little research to read, but after the second meeting, they'll hopefully process that and maybe they'll talk about field trips. I would send them to see some high schools that use different kinds of schedules, so that they could ask questions about the administration, teacher, and student experiences. Those schools, they can do that between their September 18th and maybe October, November meetings. And then by November, they're arriving at some type of consensus, or at least identifying the items that they don't reach consensus on, so that they can make recommendations. For December, and for this kind of project, it's a pretty fast schedule that can be done. And it works with the school's typical way of publishing studies, registrations, classes for the following year. Motion. That continue the presentation with 1 through 5 recommendations that we had presented. I'm acting with the superintendent, 5 recommendations and discussion continue with.
I think you wanted us to also make a decision about the matrix. Prior decision. But it's also makes that decision and we keep meeting type thing. I'd like to do those. Yeah, I just think we have one to make this decision about the matrix. And then there was a original discussion, we just clarify. These goals don't necessarily tie to matrix. Whether should make the goals actual. Okay, number 5. Does that cover that? Monitor possible research. The plan is necessary. Does that cover that?
Well, I think we're going to do a matrix. I think. Probably have to get for our next meeting. On this motion, I would say discussion that we continue to use this coverings, fast capacity, sanitation, so it's 5 different beginning. I think that's right. And then back to the next board meeting with presentation on what the matrix might look like, what we adopted. I think it's a progress. To actually look.
standing up against the flag.
Really integral to having important decisions. What we allow the superintendent to decide on versus the board decide. I think we do that.
You have a voice of what based on the decision.
The bus company, they have to have masks on the bus. You don't have choice about that. What do you do on the number one, actually, is, should be a determination of behavior. Absolutely starts to determined by behavior. I don't know if we're comfortable with behaviors. How about just let me take the behaviors out of it? I'm saying that it's 9 o'clock at night, and it has been a very involved meeting. And I am not comfortable hanging a decision on a matrix that I have previewed, but I'm not really sure how. So, and if this is resurgence of the virus, do you want us to reconvene and talk to the superintendent about it, or do you want to do our next meeting is on September 7th, correct? I believe that's my, our students come back to school for September 2nd. True, that's a good point. Just one day. That's a good point. But the freshmen come the day before, then all the kids come on September 2nd, which is one day, and then they're off. Until 7th, which is when we were 7th, which is why we. Excellent point. Maybe you can do them earlier, so just yeah, I guess I just feel like personally those 2 days, or actually, yeah, it would be 2 days, 3 days. I think the September 7th meeting is timely. I think it gives us a little bit more time. I know priorities have been changing rapidly. I know there's also a lot of community involvement. To me, it's important to start the school year at a great, but rather than more time is great. Much time in. Our primary goal is to provide a healthy and safe environment for students. That's our goal. I think the purpose of this meeting actually isn't about face covering. It shouldn't be about face covering. Our primary goal should be to keep the kids full time in school, in person. I also think our goal should get back to teaching and learning. Participating in consistent time. I'm not comfortable with the position we're in now that there are surges and we do have substantial transmission. Every county except for 2 in New England has substantial or high transmission. We now live in a bubble in Milton. I'm concerned about the future. And it would be a reasonable start to school out with case companies. Then take a look at where we are as far as grades and make a decision when schools start and whether it's a future lab. I disagree. Our numbers in all of our centers are low right now. That should be optional.
I can amend that motion if it makes sense. Then the motion to face coverings optional, indoors, outdoors, mandatory on buses, we don't have any control of that. 1 through 5 states, and the ability of the superintendent until April 7th to make a determination based on evidence data in the form of the county. Convening the board, decide if we take further actions that might not be best. It's not,
You just repeat that.
Sure. Motion, face coverings, optional, indoors, outdoors. That's just number 8 here. 2, classroom configuration for full capacity, 4x4 blocks. Schedule each forward small, 3-month periods, and size of lunch groups. Sanitation protocols made in place, custodians, maintenance. Right. Basically, the only person for all students. Monitor health concerns, coronavirus variants, and changes planned as necessary. Authorize the superintendent until our next board meeting to
We just let them decide if face masks need to be needed as resurgence or.
I'm comfortable with that. Face masks, if needed, there's a certain until September 7th. I'll put that in motion. Authorize the superintendent to make the decision if for some reason the variant goes to move, we have transmission, and there's a lot of other data changes. Masks is needed. Next day, board meetings.
I'll leave it at 10.
Correct.
And what was the concern? I didn't hear the concern about it. It was a concern.
I think I said that just about, we probably will be more about the superintendent.
No, I was assuming that. Right. I was assuming it was those. Obviously, we have access to the county. For town numbers, we should have vaccines. Part of their decision. I'm just curious. Voluntary survey students and parents to enable them to at their discretion once they're vaccinated. Maybe you're part of our decision process. And maybe even removing
On top of that, that's what I'm discussing, step forward, that one of our factors and interest is we haven't discussed majors. So it's
yeah, it would be nice to have we don't need to have this in the back. Right.
you try to add that into the motion, so that's because we haven't decided on a matrix, that, so I thought we were the matrix discussion, if you want. There's one So if the question is, what's Tim thinking?
Exactly.
I'm probably the best qualified to tell you. Look, I gotta be honest with all of you. I recommended those 5 goals. Those are my goals, right? I want this to be a place where our students, teachers, everybody here knows what's available. And then as adults or young adults, hopefully, is able to make responsible decisions. I don't even want to evaluate the word responsibilities, family decisions. What I will be looking for in the next 2 weeks is for cases or clusters in alternate because I assume we will continue to have what PMHS calls transmission. And I assume I'm not going to know a lot within the next 2 weeks about vaccination rate in school. And if I did learn more about that, I assume we'd be pretty close to the vaccination rates in alternate marches that we do already know, which are between 47 and 55%. So if I assume that it's about the same, that's still pretty low compared to DHHS's recommendation. Our goal is 80%. So I would be looking for that third factor, cases, clusters, which look in our communities in a way to affect this school. That's what I've been looking for. If that doesn't happen, then I'd be the happiest person in this room. Well, the very happiest to open this place completely. Mass optional with Jay continuing to talk about the availability of vaccines and why we see them.
I think it kind of envisions instead of maybe shifting to remote learning, we were going to have kind of a cluster or outbreak, maybe shifting that option that's required training.
In the event of clusters, we have 2 options to look at, and we would, provided DHHS is available to us, we can do this with them. And our school nurses been developing all this. Yes, universal masking or targeted masking in a particular area, like students who are close contacts, for example, and having to wear face coverings for 14 days. Well, that's not a across the whole school mandate. That's you've been exposed, and until we find out whether or not you develop symptoms, this is a mitigation measure. Another option, however, to look at the same time would be to take a class or a cohort, just have them go for that period of time. Again, DHHS's recommendations. 5 days, 10 days, 14. I can't tell you what it would be. Your epidemiologists tell us makes sense. But again, it would potentially allow us to not have to deal with the whole broad brush, affect everybody. That's the purpose. Things get completely out of control. But I believe that the day we're talking about the whole school, there's not going to be a because people are going to be looking around and going, I can't believe what's going on. And I hope that doesn't happen. I hope we never have that conversation. I'm not making it opposed.
Do we envision having testing available?
Yes. Rapid testing, and it's still recommended that people who have symptoms after they get a rapid test will get a PCR test and wait for those results. But at least if they get a positive rapid test result, they know that keep themselves in the results because there's at least a likelihood.
My feeling is that we can use the math for an option. As a particular thing is that every child in the school has the opportunity. Whether they are not. They definitely have that. Thank you.
community members that are like required to be. I think it's a responsibility by see this environment. Yeah, that we're starting a search, dealing with other things that the fall would be more certain to see. Look around the country. Having viruses don't happen. And children are affected most cases. That's been session. Already increases. In my opinion, to start higher bar. For nursing school, not anything. And then, shorter time to get high bar. But it's a safety measure that everything is pointless.
I disagree. I just think that we have, I think that we have provided, right, I think that we have provided a safe place. And I think that we've provided a safe place during the summer.
I mean, honestly, question about that thing is gonna be like, I think we take that question out of the end. Right.
I'm still answers to that. Because they're not, it's optional. If people are concerned, they can pronounce it.
So all I'm saying is that if you're,
Why don't you move the question to zero?
The inventory on buses, classrooms, sanitation, water, and this would then have the authority to grant if needed.
all those in favor, all those in favor. Right, emergency operation.
So what was the motion passed? We can't see.
Sorry. Sorry. I know, I said everything. Sorry. Motion passed.
Thank you.
This is a plan that's required, it's generally something you see in, principals usually update these, working with public safety officials, each year, they provide boards and submit to the Department of Education prior to the, well, when we received it from Jay, there were still a few things to be done, but I understand that those things are all done.
Page 25 is.
So page 25. Moving on. Let's see, highlighted here. 26. Now, before, because again, of the format, that's also requiring updating. So even though it's an accurate list, as of today, for example, if Easy is not going to be here this coming year, so we can take her name off. And so the start, I don't know what is activated on staff, so update it accordingly.
And if we accept the emergency operation.
Any discussion? All in favor?
And if we accept the faculty staff.
All those in favor?
And if we accept the student parent handbook.
Yeah, quotation, there are no privileges. We are going to continue with last year's practice, which is a student has a first period study hall or fourth period study hall that they can use early or combined exists. So that is really the only teacher privilege that has existed. What I would like to do is seniors in particular, once the school year starts, ideas that they might have that are a little bit creative. What I heard you said, but pretty limited. Right.
Also, I have a question, I'm sorry. Page 42 regarding study hall. So I guess I'm confused as to we're gonna allow them to be on some gaming devices that they can't play board games or that they have to be individual or not.
So there's two parts to that question. To answer them both, we indicate that kids should not be playing cards or using some game devices that they're on study. It's been very difficult to enforce that over the years. Over study hall, been 50 plus students in the cafeteria, and so trying to handle that is incredibly hard for a teacher. Moving into this year, I class time was studying 81 minutes. So a student very well may finish all of their work. And then who are we to say you can't be on your phone? So it's a thing to manage without us looking over the shoulder of students and not even know what we're done really to be. It's very incredibly difficult thing to manage. It has been on the books and it's been in the handbook in years that students should not be using. It's one of those rules that is quite simply unenforced. Okay.
I just want to make sure that I know some confusing.
I think it is the right to listen to the call. Everybody next week is very much to try to review.
And then, the calendar, we're not just to be updated.
The calendar has been updated, yes. You do that, so. kind of the thing that I don't know if it's the accurate kind or not, since we turned this over to the SAU office, we've been making updates in the
I'm in favor of. Yeah, we're not supposed to, right. It is, the recognition, a lot of it's
Here, we had to sit in our little study hall and stare at the wall, so. We didn't get. It's just. Harry didn't know we were with it yet.
So, I'm not quite sure what to say, but are you okay with us continuing our practice of not enforcing those?
I have been. Yes.
The only other thing that I do want to bring up right now, discussed earlier when we were talking about changes that may existed. The only other piece in here is about the rest of them. Obviously, I'll update whatever decision was on face masks, that's an easy solve. But I also did make a request about hats. I'd like to buy hats again. Can you minimize a lot of unnecessary costs? And I think that is appreciated.
I don't need a meeting, I'm sorry. I still didn't follow the same restaurant, Yeah,
No, yeah.
And so have to be allowed in classrooms
Yes.
while people are teaching.
And we did a lot of here, we did not have a single incident of an inappropriate hat or misuse of hat.
Right, I think it's just a sign of respect.
That has been,
Yeah, well, no, I got it, I'm just saying, I
and that has been the, when I've had to hear my conversations, and it's very good to me, that they can have respect for bringing that. But it is something that has been brought up to me in my face, and we're not going to be past here, and I said I would do that.
yeah, but I guess, I understand your point, I just personally feel like in the hallways it's fine, but in a classroom situation, it should be removed, during the pledge or the national anthem. That's just my personal feeling, and I sometimes worry that we are letting go of some of these things because it is a hassle and it is. And I want to make sure that we're still instilling respect. But I agree with the pledge.
Yeah, but keep in mind that we can't require you to stay at
Right.
and so there are values that we're playing. And I agree with you as well that there are certain times that I'm actually, and I'd like to be going into learn these things now and make those smart choices that I want to experience now.
And the teachers react.
Like here, teachers who are not under education that here that so I'm sure that there are some who feel sympathy, feel that this is not where I am. But I think I'll consider the appropriate masks on and each other. I think,
Yeah, it's not the norm for dynamics.
As we'll change the handbook for students.
All those in favor? Those opposed? Vote on it.
give you a cover sheet that highlights some of these pages. And quite frankly, it's too different of a document to highlight. This has been something our current administration has been for years. And so it's kind of found some time to introduce some discussion. I did remove any content from our previous, I made it more consistent, I made it easier to understand, I made it more in certain sections, academic eligibility, attendance requirements, behavior conflict. I don't know if you have time to read through it, I'm happy to answer questions that you might have about it. I think it's just a cleaner and easier to understand to reference.
Are there any, I mean, I feel like it's sort of here the substance changes, we're sort of not looking at the other side.
Okay.
That's just it, not.
Sure. Academic and athletic eligibility. The only pickle that we're in here is wording in the first paragraph of each student under academic and athletic eligibility that a student athlete must be eligible by NHRA standards. However, if you just academic eligibility falls in a situation where students are only taking 4 classes if they have a full schedule. Some teachers or some students may only be taking 3 classes, which is completely appropriate, which would make it impossible for them to pass 4 courses. So, policy that is explained in section 1, I think makes clearer sense. Attendance requirements, again, nothing was changed there. What I did is I separated out into 2. I talked about if the student is sent home due to illness, that they are not allowed to return that day explaining leave or practice. That was very in the previous policy and sometimes overlooked by students and parents. The behavior they're the same from the previous. This is the state that was established years ago when they athletic committee subcommittee board. The wording that I changed is in section 3 under tobacco on page 4 to include liquid cigarettes, electronic cigarettes, baby tools, things of that sort. But in terms of consequences, most of it has been consistent. The one exception being under 3A, lowercase I, 2. That the student athlete addresses the team by accepting responsibility for their actions. Teammates their 4 points. This is something that has not been done in the past. I think it's something that is important for student athletes and teammates to take accountability for their poor decision making that ultimately impact the team, not just the individual. And I've added that same verbiage B on page 5 of the clear lowercase I section. We're following the NHIA recommendations, which is what Pleasant Spring, which is it's up to the local school. This is fine, accepting that masks are used that they're not. Sure.
I'd like to add one thing to that regarding competition. There were a couple of isolated problems in the state last year where schools showed up to play in the both teams said, our policy is this. The visiting team said, we don't do that. It became a big issue. So one of the things I've said to the principal and the director and the coaches is, as polite guests, we should do as our hosts ask if something like that happens. That's it.
And our directors communicate with each other. Everybody knows well in advance what that home school is doing. There's no surprise. Page 5 of sportsmanship. I did add some verbiage to sportsmanship number 1. Got rid of some of the old stuff that was being demonstrated that we have the right to pull somebody from a team or suspend them temporarily for behavior. What we've seen increases over the years, if our kids misbehaving, but not doing anything that violates a rule or handle and student athletes in particular need to know that behavior is important. Regardless of your breaking a limit. So we be able to say, hey, you know what, Tim? You're being equal and you're doing defensive. Cleaned up expectations on page 6, cleaned up transportation on page 4. I added a section of communication that is on page 6, it's over page 7. I tried to define the expectations that are superintendents, social media, we this year are supplying all coaches with PMHS emails that any communication can be done and will be done. Email. On page 7, I outlined the appropriate contact procedure in terms of when to contact coach, how to contact coach, and the steps that it takes to then get a resolution to a problem that you might have. This was not outlined in the previous year. What I removed from the old handbook entirely was a lot of stuff that was specific to coaches and was not for students and parents. Responsibilities that no one had. Oh, yeah, that's the update. Sorry.
Okay, let's try that one again. All those in favor? Okay, thank you. All right, we moved the personnel report to our non-public session. So on policy. These are the fees are offered.
The only change from your first reading was one that accommodates the principal's request for that was already discussed. It's highlighted in yellow on the sheet.
Start with the, like, policy summary for the school year. I don't want to read all. For the individual changes, in the table.
You're not going to get them, or do you want to talk about?
Yeah, I do want to do them together.
Just moving the whole slate of 2020 recommendations.
Any discussion? All those in favor? So I
So these are, so the it's really two topics, but it's a number of policies. JFABE is education of children in foster care. It works with the policy formerly known as the Payments of Homeless Children. This is recommended. It's why we brought it to first reading in June. The others, all at once, are the J code policies, JID. You can for yourself, JICD. They're all related. All these J policies relate to student discipline, and this is the recommended language from the School Boards Association that updates these policies because of changes in state law. That's what
I'm gonna read all these in. I move that we, approve policy JICD. JI, JIA, JIT, JITB, JITD. JICG, JICH, JLIF. For second.
Second.
Any discussion? All those in favor? Aye. Running down to, our second public.
I know Senator's going to be quiet. I just wanted to ask one more question. Didn't get an answer on where the decision-making process happens for children from the prom. Is that something that we're able to give an answer tonight, or is this something that's going to have to be investigated?
I'm not aware of it at all.
That was not just, telling you what parents have told me it was.
Please, please. Not aware of it, so it'll have to be investigated.
Thank you, ma'am.
Feedback, perhaps a suggestion. I've been watching the clock from all the agenda items that she had on her today. It took us an hour to go through all this public input, a huge amount of time. Then I tried to type the superintendent's presentation, but I thought it was relevant information. In another district, we have had the structure set up whereby someone has the opportunity to speak for 3 or 5 minutes, and then they rotate through so that everyone has the opportunity to be heard. And if they have additional points to be made, then it comes back to this time block, which allows the course of business to be conducted while we're all still fresh and not exhausted. So perhaps that's something to consider, as well as the inclusion of the policies for public in the materials that are provided. To be very helpful. I do want to correct one point that was made earlier. Not everyone in this building, by age default, has had the opportunity to be vaccinated if they want to. So let's just be super clear on that. And again, I don't want to make this debate about whether or not people should or shouldn't be vaccinated, but let's just be cautious that some people don't have the option. So as we're thinking about what protocols look like and where we move forward and back, let's just use considerations. The last thing I'd like to share is, if nothing else, tonight's meeting has demonstrated the amount of passion around this topic of what it means to reopen schools safely. And I do think it's important for everyone to be heard and have the opportunity to help. But to the principal, to the administration, to the school board,
I know there's been a lot of talk about the need to not mask ourselves or our children to allow them to have that spiritual spread and because we want to be able to teach them empathy. But there's lots of ways to teach kids empathy. First and foremost, consideration to the fact that someone else's needs might be different to yours. That's a demonstration of empathy. So let's consider the whole spectrum of each of these words that we're using when we use them. The other thing that I've personally experienced as an adult, and I'm sure will be something very prevalent and needs to be monitored in this building and outside the building, is bullying. I walk through the market today with a mask on, and the sideways looks that I get are innumerable. So I think we have to be very careful that when we say it's a choice, that people really do have a choice without passing judgment in either direction, whether you choose to wear a mask or not. That bullying is something that becomes a very real reality, and we need to be very cautious and aware of, especially in this age demographic, where everyone's trying to find their way and establish a pecking order inside the building. To be honest, we've all been here, we all know what happened. So I just been asked the administration to be very, very real risk, and for some kids, the option doesn't take this year without a mask, and it shouldn't be judged as such. So, again, I applaud your decision, but I agree with the great officer of the presentation. COVID is not going away, and we have to learn how to peacefully coexist with it. We have to learn how to support and embrace each other as a community, to come together and support each other. You all have been attacked tonight. There's no other way to describe it. And it's because people are passionate about their perspectives here. And everyone should have the opportunity to speak. But if you've been attacked for being a decision maker, imagine how the kid whose family has made a decision and doesn't have a choice is going to feel when they're attacked. So please, 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 please let's be mindful of that. Because if we want to talk about racism, don't discredit any of the data points that were shared tonight. But if we want to talk about suicide, bullying will lead to suicide, whether you're masked or not. Let's consider all the factors involved.
Just want to make one quick response. I absolutely agree. Nor quite promote any bullying of any kind, no matter what your choice is your choice, it's your right. What I also would like to say and bring up to light that when I was at our ACS school meeting, that same judgment was passed on me because I don't believe in certain things. I believe that people should have a choice. And I had a parent that said, I'm not going to sit over near you because I offered that person a closer seat so that they could hear. And they told me, I'm not going to sit next to you because you sound like you're not a vaccinated person. So I do also very much agree with you, young lady, that bullying has no place at all in any school, in any society, and that we need to protect those children from possible. Thank you.
You mentioned about testing. Are you going to contact the parent, and are we going to have the right to look at that?
I can answer that. Yeah, we did this in one of the other schools last year. And 100% of the time, if a child is symptomatic, it's presented to the nurse calls the parent or guardian first, and only administers a rapid test for COVID. Parent consent. Otherwise, the nurse's message is your child has symptoms and needs to be picked up. It's entirely up to parents. In a high school, we serve a population that includes over 18, and we make our own medical decisions, and that's a little bit different. We did this in elementary school last year, so the answer to your question, we would not do that without parental consent.
Anything else? And kind of close it. I need a motion.
We're going to go into session under RSA 1A, 2A.
Jason, yes.
You're now in non-public session. Thank you. Thank you, guys.